Okay, everybody, Michelle here, family nurse practitioner, coming to you from Starlight Essex, and we have our super beautiful client with us today, and she is a patient of mine before, so we're going to do her second round of the EndyMed platform. So I just got the updated version, so I cried a little bit when I took my pro, but here we are. So now I'm really excited to have this guy. All right, so we're going to go ahead and get started. So when you have the device, right now we're set on, we're going to do our microneedling first, radiofrequency, and then our radiofrequency skin rejuvenation. So your tip is going to come like this, and we're going to go ahead and open it. The protective tip, you can see I put a little X on it because you don't want to throw it away. It's going to help protect your device. And you probably heard in other videos, I'm absolutely positive this was created by a woman because you can pull it out and you can figure out where it goes on the tip, because there's a wider clip and a thinner clip, and you're just going to line it up on your device head. This is your second full treatment, right? Mm-hmm. Okay. So device is super intuitive. So once I hit face, it's going to tell me that both our ablative hand pieces are on the machine, but these are all of the devices that are able to use of the hand pieces on this particular face. So we're going to go to our intensive max. But before I do that, let me just show you how smart it is. So I hit face, and if I hit FSR, which is this one, it tells me it needs to be connected to the other side. So honestly, dummy proof for lack of a better term. So now we're going to hit our intensive. Once we do that, and I hit start, oh, it wants to know where we're going. So let's do the median. You'll get tactile feedback, and you'll also get the blue light. It's going to tell you it's ready. So here we go again. Tactile, it shakes in your hand, and also the blue light. So with this one, we use a foot pedal. And I'm going to go ahead and start on her cheek. Now, different people have different techniques, and you're going to get your own. However, I like to start with the cheek because this will help her to understand and feel and have that pain sensation that's not painful. And by the time we get to the more sensitive areas, she'll be fine, and she won't worry about that. Now, it has 1,000 pulses per device tip. What does that mean? You could use 1,000, but I don't know why you would. But you might if you're doing like a back or belly or abdomen or face, neck, and deck. So definitely nice that you can use it for 1,000. If you look at our pulse width, our depth, and our power, if we switch to thick, it's going to change. Our pulse width becomes 110, our depth is 2.5, and our power. Now these are generic settings, so we can actually change those, of course, if we want. I do recommend that for the first treatment, just stick with the factory settings. I mean, you can change after that based on their result and their tolerance, but in the beginning, be gentle so that they know what's going on. She's been consented and numb, so she has thicker cheeks but not large. So we're not going to go the thick. We're going to do thin, medium, and we're at 80 pulse width, 1.8, and 12. Now, when we get, she has an old scar that we've been working on. Big improvement. We talked about that earlier today. And on that one, you're going to see me change to the thick M, and we're going to do one fire right on that, and really go down and create that tunnel for the skin. So we have continuous and single mode. So what I do is I do a little test. I have to turn a little bit for me. How's that? Good. So I'll do a second one just to make sure. You good? Mm-hmm. So you hear that feedback. Now I'm going to go into our continuous mode. This has continuous mode of slow, moderate, and fast. So if you're brand new, you can go slow and not have to put your foot up and down on the pedal, because it will only engage when the foot's on the pedal, and I'll show you how that works. Once we pick, I'm going to do fast, and then I'm going to hit start. I get the tactile and the blue light function, and this is what it looks like when the needles come through. So, did you see it? We have students in the office today, so now she knows how this feels, and now we're going to start our passes. So now I don't need to do individual, I can do continuous. This is going to help me a lot with her comfort and also her result, because I can get through really quickly. Since we're doing not just some microneedling for her, we're also doing the skin rejuvenation. So if you watch enough of my videos, you know I like to do the lateral borders first so that I can just quickly get across the face in a snake-like fashion. Yes, there's a 10% overlap. Great question, thank you. So there's a 10% overlap, and 10% is just fine. Now she has reactive skin, we've seen this before with her, but she has amazing results. And we're going to be using the Rejuvenation Pro Post-Care serum, and I'll show that to you when we get to that point. And she'll send us a picture about an hour after she uses that, and she'll go home with some of it. She will also have less swelling at that time. We can have mild erythema and a little bit of swelling because we're sending quite a bit of heat through the gold needles. How you doing?
Good.
So you notice I'm not pushing, I'm just making contact, resting, letting the device do the work. What you sometimes see later is a little, almost like the crisscross markings, if you will, and that is when the skin is purging up pigmentation, and that's creating that beautiful collagen. So if you add this to your collagen induction therapy, you're utilizing mechanical trauma and also heat so that you're able to really optimize these results. And you guys can take photos in the video if you want. So we have students in here today as part of the fast track. If you're interested in that, get a hold of me. Today they're doing advanced filler. Yesterday we had advanced tox treatments, and we did full face neurotoxin and had a lot of fun yesterday, huh? How you doing?
Good.
Just do a quick check-in. If she's doing fine, I just keep going. And you notice I just took my foot off the pedal to stop the engagement of the needles. Now, keeping in mind, if you're in continuous mode and you come off of continuous mode, or you don't come off the foot pedal, it becomes a sharp because it will continue to engage. So just make sure that you're taking your foot off the pedal. Now, you wouldn't know this from her because her skin's so great, but she has a skin type between 5 and 6. So I always tell everybody if there's ever any question, if they're a 5 or a 6, then they're a 6, period. Don't play with skin type. Now, we're not limited by skin type with this particular device, but if you're using IPL or anything light base, then you would be. So just keep that in mind. So the device that they replaced this one with was the other version. This is now the 4th generation, I believe, right?
Mm-hmm.
So 4th generation device, and so it is crazy fast. I went from 80 to 100, right, on power.
Yes.
And the timing of this continuous is wild. It's amazing. Which is pretty comfortable. I mean, I see a few wincies here and there, but
Yeah, right now I don't even feel anything.
Oh,
I feel
okay.
you applying the
pressure.
tip there, but that's it, yeah.
Okay. So I'm going beyond the jawline because she wants a little tightness there. So. And so now we're going to be going over and getting near that submental foramen. So just keep in mind when we're generating heat around certain structures, what comes out of foramen, Andrea? Remember when we talked about it yesterday? Veins, arteries, and nerves. So now we're getting near that infraorbital and then also the submental. So just go quickly in these areas and coach people through. Arteries that come out and nerves that come out, they don't really appreciate heat or anything like that. You can actually elicit a pressure response. I don't know why you would, but you could.
Is there an age for this machine?
What do you mean? Like age restriction?
Yeah.
No, not really, but keep in mind when people get in their 70s, their growth and collagen is going to be different, but I do patients all the way up to 80,
What about
80 years
young?
old.
Is this like 18 and over?
I mean, it'd be really good for acne. So for acne patients or anybody with bright problem skin, absolutely. Good. So now I'm kind of done with that. I'm going to come in a little bit closer here, so just feel me just a tad. Now notice that I left the thinner parts of her skin alone, and we're going to change our depth. So I like to just change it once. And you can see I call it the cleanup if I don't see any erythema, but we're pretty close. We're going to do one little fire there I need to do. And you'll need to look really quickly as soon as you're done because the way the device does coagulation on the way out, sometimes the erythema on some patients will go away pretty quickly, and you don't want to be feeling like you didn't catch that area. So again, I'm going to do that lateral area. Hopefully I don't have coffee breath.
No.
Give me my coffee. Dear nurse. 27 years, I gotta have a coffee. Now for filming, I'm sitting on this side, but normally I don't do that. I just fly my chair around the other side and do that, but I want to make sure that you can see. So I'm doing this lateral portion so that once I start my snaking, I can just go pretty quickly. And not have to be quite as delicately precise near that hair. Now, can you use this in the head? You can, but you need to turn off the heat. But why would you do that? I mean, I don't know. Do you have anybody that does that a lot? Uses it for?
Yeah, we have some providers that do.
Yeah, for like hair with it. Yeah, you could. You certainly could, but not with heat.
Right.
Yeah, not with heat. Now, when I do men, they tell me their beard comes back in a lot thicker, so that makes sense. Ryan was like, "Can I keep my beard?" I'm like, "You can." And then we were gonna do his neck, and then we were just kind of running behind yesterday, so we didn't get to do it. And he's like, "Next time my neck." I'm like, "Yes, yes, my friend." How's your pain?
Good. Yes.
0 to 10. Or are you just more aware? 2.
Around the jawline, it feels a little more
Spicy?
sensitive. Yeah.
Why do you think that would be from an anatomical standpoint, friends? Well, there's foramen, the nerves run along there, vessels, yeah, everything. It's not got quite as much padding there,
Yeah, but I don't feel anything in the cheeks.
which is why I like to start there. It's a psychological thing. And interestingly enough, Ryan said yesterday, remember what he said the pain was?
I do.
Yeah.
Yeah.
She's like, "Get that job."
Can you do this if you've recently had filler or Botox?
I
What's
don't-
the waiting time?
I tell people 4 weeks for any heat generating things. Now I'll do Botox at the end of this treatment for sure. And if I want to do lip filler for her, I'll do it. I'll treat her neck if I haven't treated her neck. I mean, it just depends. But I don't do filler same day that I do RF. No. Or threads or anything like that. This thing is so fast, girl. It's so fast.
Day and night.
It's wild. Even though I miss mine. I was so used to my pro that I was like, oh, I just can't take it. Don't take it. Don't take it. We've been through a lot together. So then I have to look and you said it's 100% coverage. Even doing it from the other side, so. So I'm gonna avoid that eye area because I'm gonna change the depth on it. What you don't want to have is like patchy areas, so just be careful that you're doing that 10%. And even crossing over, it's easy to judge. If I have holes, it's usually a whole row where I've gotten off on my row. And just go back and do it. Now, can you do this twice? You could, but why? I mean, you don't need to. The power is there. It's not necessary for the patient. That might be spicy right here. Now, in the past with radiofrequency, you had to be grounded, right? So who cannot have this treatment would be someone who is got a pacemaker, metal near the area. So if somebody has a total joint, that doesn't preclude them from doing the face. So just keep that in mind. You just don't want to do anything that generates heat.
What if you have braces?
Braces are fine. Don't you think? I've done braces.
I think so.
Yeah, I've done braces. You know how many adults have braces right now? It's crazy. And usually those are great patients because they're investing in themselves. So they're all over that. They're like, yeah. It's gonna be spicy right here. So then I avoid that peri-oral area because I'm gonna hit that with a different depth. I hate to tell you this, but I'm gonna turn it up while we're here, and I'm gonna get that nose in just a second, okay? So I'm gonna come across here. So now I'm gonna marry those two sides. So for her proposed care, just like any other ablative treatment, avoid sun damage. She's really good about that. Other areas that we could treat. This works really good on the hands. Hands are a big deal if you're not treating hands. It also does sexual health, so you can do labial tightening with it, labial rejuvenation, collagen, because remember, it's creating heat and collagen, so it will help with sensitivity. You can use the skin rejuvenation if you have someone who's wanting to improve that area and the look in that area. This area is kind of spicy myself too.
Yeah, it is.
Lots of little pencils and nerves everywhere. Sorry.
No, it's okay. It's really not bad.
No. And this is where she had like a little bit of old acne scarring. And so we can really get in there and make a big improvement on that. In this area, like a 4.
I'd say maybe 3.
Okay, so just a little bit more. And then I snake around so that I can get that 10% overlay on my previous row, so that's how I end up with usually 100% coverage in those passes. Even though I'm reaching over, which I never do. If I'm filming, I'll do that, but other than that, I don't really do that. So we're about 75% done right now. Now I'll just change depths in just a second. So I like to do all the depths I'm going to do once, just like when I do my regular microneedling. I'll do all the thicker areas, and then I'll come back and I'll just change the depth one time.
Is there a guideline for the depth based on what area you're on?
There is. It's thick, medium, and thin, small. So like thin, small is going to be eye, peri-oral, peri-orbital, forehead. Yeah. Now some men have thick, like yesterday on Brandon. On this video, I could have went out to thin nose, but I didn't. So we're going to do this our nose right now. So I'm just gonna apologize in advance. We've been working on this scar for a long time. You ready?
Yeah.
So she has an old scar. We're gonna do 2 pulses. Oh, helps if I do that.
I was like, oh, I didn't feel it.
Yeah, she's like, yay. Okay, here we go. Take a breath. We're gonna do one more.
That didn't hurt.
Oh, it did it?
No.
Girl, I love that. Okay, so now we're gonna come off of that. So we've been working on this, and this is the first time she's had improvement with any treatment on that nose. This one, since we've been doing that.
Yeah.
So let's do, I'm gonna do around the mouth first, and then we'll go to the eyes. So don't pierce the vermilion border, but get right up there next to it. This will help when she has a little bit of lip filler, or to help prevent peri-oral lines. You doing okay? Okay, now on this one, remember you're gonna take your tongue and go over the teeth, and then whip it off there a little bit, just to put that. There we go, really quick. 2 more. And then the last one, the worst one. Okay, done. Woo! Now you can breathe, now you can breathe, now you can breathe.
It's really
Not as bad as I'm gonna be on the nose for a minute, but at a regular depth. So this is gonna help. She had a little bit of old polymorphin. We did a skin analysis for her first, and so this is really only her. I wouldn't even call it a problem area. I would say it's just common.
That I
Spicy?
can feel, yeah.
Okay.
A little bit.
Good. Good. Good.
Mhm.
Good. Okay. All right. So I'm gonna come around the temple area and under the eye. Now remember last time I'm gonna pull down really hard because with radio frequency it'll be on bone. So I use my hand. I know where her orbital rim is, and I'm gonna pull the tissue down. I'm gonna start on the lateral aspect. Get more of that small. So make sure. So now I got all the way up to the eyelash, but firing on bone. Okay, I'm gonna turn this way. I'm just gonna follow. Okay.
Mhm.
The eyes to me are kind of spicy. When we
Yes.
do heat, yeah.
A little bit.
That's what Brennan said too. He was like, oh, it's a little bit not
Right.
intolerable by no means.
Yeah.
Now, if she was older, I would have taken this upper lid and pulled it way up over the orbital rim and hit those little fine lines and wrinkles in there. But she doesn't. She
I'm
actually-
noticing them more.
She doesn't need them though.
My eyes are just a little.
Yeah. So then I like to get, now you gotta be careful with women who have the tattoo spicy right here because we have the little frame in there. There's lots of superficial veins, arteries, which is why I don't use filler on the forehead unless you're really experienced. So I'm gonna do just the eye, I do around the eyelids in those little areas first, so that as I'm sneaking around, I don't have to get close to them. We don't want to use radio frequency on anybody that has any tattoo ink, or I don't trust the whole henna, I don't trust any of the microbleeding. You don't really know if it has metal in it. So if it has metal in it, it can burn the patient. So we're just gonna stay away from that. So basically right now I'm creating a square for me to do a treatment by doing those closer areas, and now I can just do the forehead and not have to worry about it. All my little sweet tricks. Pretty versatile, right?
Yeah.
Spicy right here.
Mhm.
Okay.
Mhm.
We'll be done in about 3
It's
minutes.
worth it.
It'll be about 3 minutes, we'll be done. Also, the reason I leave the numbing cream on the full 20 minutes is because once I get done with this one, we're going to move to the other skin rejuvenation, and it generates a lot of heat. Now, I was expecting Ryan yesterday to feel a lot more heat, but he said it was fine.
Yeah.
That little scanner is so powerful, too. So at the end of this, if I wanted to use neurotoxin, I could. If I wanted to do lip filler, I could. If I wanted to do ultra dilute radius on her neck, I could. Anywhere around. If she wanted her hands done, we could do her hands. For practitioners, don't forget the hands, because people don't like how their hands look. It's a first sign of age. The neck, yes, but the hands even more so. I love that you finally got to come in and get this done, friend.
I know, me too. I couldn't wait since the last one.
She was like, ugh. I saw her after that. I was like, holy cow, girl.
Yeah, a lot of people noticed.
Yeah, look at Dr. Sarah.
Yeah.
He looks like a different person.
Yeah.
He's had 2 full on. He's so spoiled. He got the Michelle glow up. He's in Kansas City this weekend. Are you going to come by?
Yeah. It's so
Yeah, that's right. I was in Minneapolis and then he went to Kansas City. So there are new places for us.
Oh, wow.
We'll start going there.
Is that for your training?
I think they're thinking about like trying to change and add some Midwest areas because you know it's growing. But, you know they do a lot of testing to see where there's a lot of new injectors and stuff, and so Yeah, I'm excited about it. It'll be good.
What's the aftercare for this?
So she's gonna be no sun, no abrasives. So she uses Definage skincare, which is why she has such beautiful skin. But she uses Definage, so she knows how to do that. So it's a mild cleanser. And then she'll use the aftercare that I sent home with her today, which will be the Definage post care. And then she'll check in with me about 2 hours after she leaves. A lot of the redness, actually once we use that Definage, then the redness, a lot of it will go away immediately. It's wild.
How long do you not exfoliate for?
I tell them about 21 days. I like to get that full, skin rejuve set so that they don't have any, okay?
Yeah.
These are spicy, I know,
Yeah.
sorry.
It's okay.
I know, these are a little bit spicy. Now, if I saw somebody who was like that and they couldn't tolerate it, all I might do is, I might come up off the depth. The power I'm gonna leave the same at first to see if she can tolerate it, but just maybe change the depth.
I can. It's just a little like.
No, I know, it's just spicy because you're not
Yeah.
expecting it. But this is why I don't do the forehead first. This is why I do all of the other areas. Again, she knows it's not gonna hurt.
Yeah.
She knows it's gonna be over pretty quick. There's always a method to my madness on how I treat areas. Because I want to get the best results I can for my patients. And sometimes let's just face it, I have laughing gas, so if somebody like Dr. Sarah can't tolerate treatments, then I just move right to laughing gas. I also don't charge for it. I just ask them, I send home, I have like my little branded bags, and I'll send the tubing home with them and ask them to bring it back, because it's kind of expensive if they're doing like serial treatments. Okay, we're going to be on this side over here. Again, I'm going to mark my area. I'm going to be on the outer eye, okay? I'm sorry.
Okay.
You go, girl. And then it's funny, you'll start to see blotchy. So I tell everybody when you're doing this, look right away, because if the blotchy goes away, then you start thinking, did I not treat that area? But just know this machine is like that, and it is so powerful. It'll close that coagulation. And so that's what's up. So you're done with that part, so we're gonna flip hand pieces.
Yeah, the tissue.
Sure. Would you grab a tissue right there for her? Thank you. Don't worry, her eyes water every time we
Yeah,
do stuff.
I know.
Don't worry.
I'm not crying.
And then
It's
to change for this, we need to be on the left side, which is our ablative handpiece area that everything has to be on the left for that. It's intuitive. It tells me, hey, you're unhooked. Because of the way that power works, the 3 generators in and the 3 generators out, the ablative hand pieces will be on that side. So I'm just going to switch them, because like any good ear nurse, I always feel comfortable with spaghetti. So I'll flip that around. And I always put this back in, even though I know it won't work on this side, just to keep it nice and safe, because the energy that comes through there, if you were to crack this, you would need to contact the rep right away, because we're not going to use it. So. And so it already told us the handpiece was disconnected. Okay. So now I just leave that on until I'm done, and then we switch it. Questions on any of that? Fun to watch though, right? Oh my god, me and my sweaty man hands. Will you turn that fan towards us? Yeah. Yeah, that's all you need to do. Yep, perfect. I'm in my postmenopausal phase, okay?
Oh, that feels good.
It feels good, yeah. Well, that weighted blanket, most
Yeah,
people
it's
love
nice.
that, but then it also gets warm.
Yeah.
Okay, so also we have our next hand piece. So the consumable is your only cost once you've got the machine. And so very intuitive as well. Don't throw these out. This one actually does say protective cap. Unlike the other one, it does not, so that's why I put big black X's on it so it doesn't get thrown out. And then again, you're gonna pull this out, keeping it very sterile. And again, it's gonna have two little cutouts on the side. So they just line up on the handpiece and it clips right in. Just don't touch the front of it. Would you do me a favor, Andrea? Would you open that drawer and then hand me those little airbrush curlers? Yeah. This is my version of jet drawer. Okay, so you're gonna wanna order these. I like to use these to clean it because we're gonna clean off that cellular debris. It's gonna tell us when we need to do that. Again, we're gonna hit face. It also knows if we want to go back to the intensive, it's gonna say it needs to be on the left side. So there's no way to make a mistake. I love that so much. And then now we're going to the FSR Max. And again, we're gonna start over here on thin medium because we're gonna start on our cheeks. And then we're gonna hit start. Now this does not have a foot pedal and it does not have continuous mode. Okay? So we're gonna be manually clicking it. Once the light's on, then you know that it's completely engaged. I'm gonna start over here, okay? Let me know if the heat gets a lot.
Okay.
How's that?
Good.
So you just wanna hear that brrr, and then the fire is complete.
What's the overlap on this one?
Same, 10.
Okay.
And thanks for asking that. So on this one, you can see the pins. The pin is the overlap, not the plastic. So the pins are closer so that it's gonna be, your overlap is gonna be a lot closer than you think. And what happens if you get put too close? Nothing. It just takes you longer. And it's not gonna impact the results one way or the other. It will impact it if you're leaving space. Doing okay?
Mm-hmm.
I know this one's hot.
Mm-hmm.
Too much? Do you want laughing gas?
I'm driving home, so.
It's okay. Safe to drive.
Want me to adjust the fan? Is the fan too much on your face?
No,
Oh, no,
she,
the
it's the
fan
heat.
feels
It's the heat. She likes
Yeah.
the
Oh,
fan.
for you.
This thing's hot. Oh no, it's fine. It's perfect. And again, I'm going to treat it just like I did the other one. I'm going to use it on this thin medium, and then when I get to the other areas, we're going to switch.
So does the patient experience like feeling like little prongs on the first one?
Like she said, she felt, I don't know, what did you feel?
In the areas that I could feel it, it just felt like a little like prick, kind of like, yeah, really fast.
So now it's
Spicy,
going to tell us, wipe it with alcohol. I don't use alcohol with anything generating heat. So you're just going to clean this, hit OK, and then we're going to go back.
And on this one, what do you feel? Do you feel like
It just feels hot.
Yeah, it just
Like, it just
generates
feels
a lot
like
of
a-
heat.
Mm-hmm. But you don't feel the little pins. It just
Yeah. It's
Yeah,
scanned.
it's
So remember in your book how it shows that it sends the heat from one side to the other. So it jumps from, like, say, the left to the right pins in a very organized manner. And so because it does that, it's gonna spare that intense heat on the epidermal layer, but it's gonna go deep down inside. And then what happens is it creates that neocollagenesis. So it's gonna create, faster cell turnover. I know this one's hot, sorry. I'm gonna go fast. And again, I'm not pushing, I'm just resting it onto the tissue, letting the heat do the work. You just want to make contact. Good? Almost hot?
yeah, a little bit.
You sure you don't want laughing gas? I got it.
Yeah. Okay. Yeah. Try it.
Let me grab it. You guys will be there off camera for just a second.
But yeah, the areas where for the microneedling that I didn't feel it, you literally don't feel it. Like all you feel is a little pressure, Like you could feel like something's touching you,
Yeah.
but you don't even feel the needles like go in or yeah.
I feel like a treatment that I did before,
Uh-huh.
skin laundry.
Uh-huh.
You ever heard that?
Yeah.
Chain.
Yeah.
It's like a resurfacing. It really feels like little staples going into your skin.
Really? Oh my
And they don't
gosh.
numb you. But
Oh, wow.
it's tolerable.
Yeah.
I mean, I numb myself.
Oh, yeah.
Like a lot, like a 5% pain. But it really feels like little staples going into your skin.
Ow.
And it's more all on the
Oh,
bone.
okay,
So it's
yeah.
like the same.
Yeah.
That's
So-
why I was wondering if you're feeling.
Oh yeah, all I feel is like heat, but it doesn't feel like prongs or anything
Okay.
like inserted. It just feels like almost like kind of when you touch like it's not as hot, but like a pan.
Yeah.
You know, like you
Yeah,
just
yeah,
kind of
I
like
hear, like-
touch. Yeah.
Yeah.
But it's not like I don't know. It's not crazy. It's not like but you just feel the warmth, like especially around the jaw,
The
bone.
bony area. for
Mhm.
sure,
Yeah. And it was a resurfacing treatment. Yeah, I really like this. I'm like, it's
I
always
want to
so
do it
worth
so
it.
bad.
Yes. Yeah. It's addictive. Because you see the results and you're like, yeah. I've had a laser treatment once, and that one was like really hot. It felt.
So with the gas, will she? You don't go to sleep.
No, this is just like these piece swipe. Take about 5 nights. Long rest. So
Just makes you loopy.
yeah, it just
Make it
makes
a
her
little-
like less
relax.
less aware. Yeah.
Right.
Just
Do I like inhale it or
Yeah.
what? Oh, okay. I've never done it.
Yeah. So you're gonna
Okay.
take a nice long breath. So this is Nitronox. So if anybody wants to know about that, let me know. We can arrange for you to get a call from who I got it from.
Michelle, do you have a special license or background or anything
No.
to use this?
Just trained. Seem to be trained officially. How you feeling? Better?
I love that. She feels good.
Does your voice change kind of? Yeah. Like with the balloons.
Sucking in helium.
Yeah. That's what it is. Do I keep going? Or?
Yeah. How you doing?
Good.
What's that?
Good. Yeah.
She's like,
Better
I'm not feeling
helps.
any pain now.
Huh?
Yeah. No, it helps.
Yeah, it does. Go ahead. I'm gonna go over areas a little more spicy. I'm gonna refill like taking up my fingers. Take one. Does that help with pain quite a bit though, right?
Yeah, it does.
Isn't that wild?
Yeah.
You're like, That anytime you can take a breath, just take it. That's my way. Go ahead. Better? So these are good for some people who have filler like aversion and they want to get it done, but then they also are like, my fear, and also PDO threads. I'll just get a little anxious. You doing okay?
Mm-hmm.
So it helps, right?
Yeah, it does. Thank you.
Don't worry, I always got you friends. And then I don't charge patients for Rejuvenation. I just give it to them. I want people to be comfortable. You need to take it. On this one, you'll smell the hairs burning. Like if we get the little vellus hairs, you'll smell it. And then they'll smell it, and then they'll be like, ah. And then I push it to the edges, like that one's too. Oh, that one's always weird.
You could take my side turn.
Trying to do this from the other side. So normally I'd be on the other side doing this, but I'm sure that you guys can see what's going on. Copy path. I just saw it took like 2 minutes to set up. Worth its weight in gold. And then when they're doing these ablative treatments, they are already signed for consent for it, so it's like I just add it. And so if you go to fire it and you don't hear it, it's just it needs to be cleaned. Want a puppy pet? I was just telling her it only takes a couple minutes to set it up. Super quick. Now she's like, better now?
Yeah.
Okay. We're about done. We just have a few more little spicy areas to do and we'll be done. So you can do either one of these separately without the other one.
Nice.
You can also do, as part of the NDI protocol for like bags, eye bags and things, you can do the focused hand pieces as well as the microneedling and the FSR. So you get wild results with that. I mean, unbelievable.
Do you have all the new pieces?
Uh-huh, I do. Okay, now I'm gonna change my dot. So I'm gonna go into these other areas. Look at her, she's
I'm
like,
getting ready. Forehead.
lips first. Okay, same. Same. And then the last one, take a breath. Okay. Okay, I'm gonna be at the bottom left now. And because I did all those areas, I just know I could just fly around here. Not too much. This is really gonna help her with fine lines and wrinkles and developing those around those areas. Okay. Okay, I'm gonna be up here on the eye, okay? So again, go ahead. I'm gonna pull the tissue down so it's over bone and then get in there and do like her stop.
Even when I pluck
She,
her hair,
I know, I was like, don't worry about that. I
tear
just
up.
ignore it because I already know. Here we go. I already know it has nothing to do with this. This is her physiological. I sneeze, her eyes water.
Yeah.
I do, I sneeze. It
When
drives
I
me
yawn,
nuts.
too.
When anyone does the, you want to take a puppy puff? When anyone takes, does my Nasalis or Botox or anything, I'm all, okay. With that, what's your pain level, if any?
For the eyes?
No, with your puppy puff. Is
Oh.
it better?
Yeah, it's good. Like a 2, 3.
Here we go.
That I didn't feel. No.
Do you always do full face with these?
Unless they're doing like an eye treatment, but all of my eye treatments like this, I'll treat here and then up to here so it helps with the eye lift. This particular cord is a little thicker than the other one, and it's a little bit shorter because the amount of power that's going through it is a little bit different than the microneedling. She's young, so her orbital rim is going to be way out. But if she was older, I'd be very cognizant of that. We're almost done, kid. So, how do you think you guys could integrate this type of energy as a modality, right? So, skin rejuvenation, you can put it in the bucket of collagen induction.
Mm-hmm.
So, when you're advertising it, it would be like collagen induction therapy. Go ahead. Collagen induction therapy, skin rejuvenation, thank you. Skin rejuvenation, collagen induction, skin tightening, skin brightening. It's going to do all those things, especially when you're doing a stackable treatment. So how I market these is, I think this month I have a special of like buy 2, get 1 free or half off. So most of the time patients will purchase like 3, the radiofrequency microneedling, and then I'll offer for them to convert to this for their second treatment. And then, so what does that do? It gives them potentiated results. It works, it's better for me because they're already in my chair. They're already here, so from a marketing standpoint and ROI standpoint, from a business owner, they're already here. I don't have to renum them. I don't have to have them take up another spot on the schedule, and it's better for them because they have one recovery. So it's not just a business decision; it's their overall result. Okay, here we go. I'm gonna start making. You can take a puff while I'm doing this actually. Now this area is going to be spicy because there's a lot of like more superficial vasculature. The skin is a little thinner.
avoiding heat for a certain amount of time?
Anything abraded, anything excessive, heat, cold. So sometimes I'll get asked, like, can they put ice on the area? We're trying to trigger heat, right? So, I mean, I guess if you have to, it's not really making a difference below the skin, but, you know, it's a little counterintuitive, and I'm not sure it really makes a big difference for them. Psychologically, maybe, sure. If they want to do that from a psychological standpoint, knock yourself out.
Like, can you take a shower or go swimming?
You can, but you're not going to do anything that's. I would not do the swimming thing if it's sunny, because the reflection from the water will cause like issues. Because it's ablative. Almost done, kid. Almost done. Almost done. Almost done. Almost done. Almost done. Almost done. You made it.
Alright. Walk in the park.
Woo! Let me take a look.
Thank you.
This one little side of my skin over here.
Do you have to avoid sunblock at all?
No, sunblock is okay. I tell them not to do anything but the serum that I give them today, and then she'll wear a hat. She's pretty good about all that. She knows.
Yeah. I have a sun shield, like a UV, for when I drive. Like a little shield that covers my whole face.
Yeah.
Yeah.
Let's see how much of this we have today left. I have to open a new one. So now we're all done with that, and she made it.
Alright. Thank you.
So really, pain level even so, it just
Yeah.
was. It's just better for like the anxiety of it, the
Right.
anticipation. I don't think
Yeah, I
it
think
really
so. It was
impact, because then it kind of
like
makes
the
you
worst.
think.
Yeah, the worst,
Perfect.
just like the bony areas.
Yep.
Like my jaw, forehead.
Well, at Starlight, you get laughing gas, just so you know, if you need it.
Very tall.
I don't let my patients be stoic. I'm like, nope, we're not doing that. So again, we're using the Definage, and this is their new recovery cream. Now, if I sell a package of this, I give them this as like a freebie as part of the package. So if they buy 3, they're gonna get that for free. And then now here comes the nice and cool, the Definage. And she uses Definage, it's very so amazing. This feel good, right?
Yeah.
So, no abrasives, no actives, nothing. I tell everybody 21 days, just leave it alone. Let it really heal. You guys have any questions about the energy? Not actually gonna take us that long to do that, even with our little hiccup, our peace pipe hiccup.
I would do it again 100%.
Yeah.
I love that you give that as part of a package, of like
Yeah,
post-procedure.
I do.
Mm-hmm.
And I recommend it when they're here, and then I do send them home with a little round with it. And I always recommend that. And a lot of my patients are doing like repeat ablative treatments, so they'll just purchase it. This one's their brand new formulation. I have their prototype and was giving research feedback to them, so. And then now they have out I couldn't even believe they improved on it, but they did. It's crazy. It's so good.
Are you supposed to use this more than once?
Yes, that's why she's gonna get a little.
Like every
turn it at
day
home.
until it's gone?
Yeah,
or?
she'll use it for the next probably 72 hours. She'll have enough, and then she uses Definage.
Right.
So then she'll use their wash, which is non-abrasive.
Mm-hmm. Everything gentle.
Yes. Okay, so there you go. One more time.
Thank
you. Until next time, shine bright from Starlight. And if you want me to do certain areas or anything, just hit me up, and then we'll get that taken care of for you.